heart is the centre of our cardiovascular system, and all veins eventually drain back into its right atrium. Taking a closer look at the heart, we can see it sits just anterior to the T4/5 to T8/9 vertebral bodies. The main vessels leaving the heart are the aorta and the pulmonary artery. Draining into the heart are the pulmonary veins, which carry freshly oxygenated blood from the lungs, and the superior and inferior vena cavae, which bring deoxygenated blood back from the rest of the body. When discussing veins, we need to remember the direction of blood flow. Whilst arteries start nearer to the heart and branch as they move away from it, veins start in your peripheries and join one another as they move closer to the heart. Bear this in mind, as this is the terminology I'll be using throughout the rest of this tutorial. Now let's start by following the inferior vena cava downwards. The inferior vena cava receives very few important tributaries in the thorax before it passes through the diaphragm to the level of T8. An easy way to remember this level is that the words vena cava have 8 letters. The first tributary veins it receives are the 3 hepatic veins, which drain the liver. Next it receives the renal veins from the kidneys, followed by some smaller veins that drain the posterior abdominal wall, known as the lumbar veins. Lastly, there are 2 veins that start in the abdomen and pass inferiorly to drain the testes or ovaries. These are the right and left gonadal veins, where the right drains directly into the vena cava and the left drains into the left renal vein. A higher chance of compression of the left gonadal vein means varicoceles are more likely to occur on the left testes or ovary compared to the right. Here's how the inferior vena cava sits in relation to the vertebral column. Let's follow the inferior vena cava into the pelvis. At approximately L4-L5, the inferior vena cava receives the 2 common iliac veins. These themselves receive blood from the lower limb via the external iliac vein and blood from the pelvis via the internal iliac vein. The blood from the leg comes from the femoral vein, which ends at the level of the inguinal ligament. Finally, in addition to the vena cava, the common iliacs are connected to the left and right ascending lumbar veins, which we'll cover in more detail later. The femoral vein actually begins behind the knee at the level of the popliteal vein. It travels up the thigh with the femoral artery before joining the external iliac vein. Like the femoral artery, this vein mainly drains the anterior compartment of the thigh. Also draining into the femoral vein is the deep femoral or profunda femoris vein. This accompanies the deep femoral artery and takes blood mostly from the posterior compartment. Joining the deep femoral vein are the medial and lateral circumflex femoral veins, which drain the hip. Okay, what we've discussed so far are called vena comitantes, which are veins that accompany arteries. In addition to these, the body also has a number of more superficial veins that are independent to the arteries. In the thigh, these are the great saphenous, which drains into the femoral vein, and the femoral cutaneous, which drains into the upper part of the great saphenous. In the leg, the popliteal vein receives the vena comitantes from the fibula, posterior tibial and anterior tibial veins, which drain the lateral, posterior and anterior compartments respectively. Additionally, in this area, we have the rest of the great saphenous vein, which passes anterior to the medial malleolus of the ankle. We also have the small saphenous vein, which travels up the lateral leg from posterior to the lateral malleolus to the popliteal vein. I remember that the great saphenous is on the inside of your leg because it's so great you need to protect it. Okay, let's go all the way back up to the heart. So before we followed the inferior vena cava, now let's see what the superior vena cava has to offer. The first 2 tributaries are the right and left brachiocephalic trunks, which derive their names from words for arm and head, as these are the regions that these trunks drain. Draining into each brachiocephalic trunk is a vein that runs deep to the clavicle and is thus named the subclavian vein. This receives 2 major vessels that drain the head and neck, known as the internal and external jugular veins. The external jugular also receives a smaller vein from the front of the neck, known as the anterior jugular vein. Other important veins in this area are the inferior thyroid veins, the internal thoracic vein, which drains the anterior intercostal spaces, the deep cervical and its tributary the vertebral vein, and finally the transverse cervical and suprascapular veins, which both drain into the external jugular. Before we move on, remember that the venous anatomy in this region is very variable, and personally, I've seen these smaller veins drain into all sorts of weird places. This is just a generalisation so you can get familiar with their names and locations. Now, you'll remember that we mentioned the ascending lumbar veins earlier. Let's take a minute to see how these relate to the rest of the venous system. You'll remember they originated from the common iliac arteries, which travelled upwards either side of the vertebral bodies. I've covered them yellow here so they show up a little better. On the right side, these vessels produce the azygous vein, starting from approximately T12. On the left side, they produce the hemiazygous, which joins the azygous at around T10. Additional to this is the accessory hemiazygos, which comes from the upper thorax and also joins the azygos and hemiazygos veins. The azygos venous system drains the posterior abdominal and thoracic walls and receives some of the lumbar and posterior intercostal veins in these regions. The azygos vein drains straight into the back of the superior vena cava to return this blood to the heart. Okay, back to the superior vena cava. The subclavian vein receives blood from a large vein in your armpit known as the axillary vein. This itself receives blood from the brachial and deep brachial veins, which all accompany the arteries of the same name. These drain the anterior and posterior compartments of the arm respectively. The axillary vein also receives blood from the thoracoepigastric vein, which travels over the anterior trunk, and the anterior and posterior circumflex humeral veins, which drain the neck of the humerus. Finally, just like the lower limb, there are two large superficial veins. On the medial side is the basilic vein, which drains into the axillary vein, and on the lateral side is the cephalic vein, which drains into the origin of the subclavian. These veins were first described by Persian physician Ibn Sina, and were given the names al-Kephal, meaning outer, and al-Basilic, meaning inner. When translated to Latin, al-Kephal was mistakenly changed to kephal or cephalic, which means head, even though the vein has nothing to do with the head. This error lives on to this day. I remember that the basilic vein is medial, as it is closer to the body. They both begin with B. Moving to the forearm, the brachial vein receives the vena comitantes from the ulnar and radial arteries, which mostly drain the anterior and posterior compartment respectively. These veins originate in the deep and superficial palmar arches. Additionally, the basilic and cephalic veins continue down the arm. These originate from the dorsum of the hand. At the crease of the elbow, the basilic and cephalic veins join together to form the medial cubital vein, which itself receives blood from the median antebrachial. The median cubital vein is typically where you'll draw blood from when performing venipuncture. Okay, we're very nearly done. Let's finish by following the veins which drain the head and neck. These are best viewed from the side. Of course, first we have the internal and external jugular veins, which drain into the subclavian. The internal jugular receives blood from the superior thyroid, lingual, and facial veins, and the external jugular receives blood from the occipital vein. From the internal jugular comes the retromandibular vein, which runs around the back of the mandible. This receives blood from the posterior auricular, maxillary, and superficial temporal veins. Now, there's a lot to remember here. We can help out by using the same mnemonic as for the branches of the external carotid artery, but we must remember that most textbooks don't consider there to be an ascending pharyngeal vein, so let's leave this out. Okay, there we go. Now you've covered most of the major veins and arteries that exist in the human body. Here they are all together, so you can see how they relate to one another. If you enjoyed this tutorial, please remember to subscribe to the channel and leave a comment for what you'd like to see us cover next. Have a great day.